right, good morning everyone. Hope you're having a good day. I wanted to start off today by first thanking the guy to my left here, Rick, he and all the interpreters all across the state who have been doing a great job for our deaf and hard of hearing community. So Rick, thanks for showing up every day and doing a good job. We really appreciate you, man. So the updates today are really going to be centered around the actions that we're taking as a city today. I wanted to start by, and you probably can't really even see this, I'm just kind of sketching out my thoughts on our response right now as a city. And if you can see this, there's kind of a little pie chart. And in the pie chart, I have divided into 5 pieces. And there's the public health, there's unemployment, there's housing, there's food, and there's mental health. And right now, every decision we're making, we make a decision on this, it maybe affects these 2. You make a decision on this, it affects these 2. And these are delicate balances right now that we're taking with those. This week alone, the state labor office saw a 900% increase in unemployment claims this week. 900%. It's unsustainable. And so I want you to know that those concerns are not lost on me here at the city level at all, and the decisions we're making are taking that into account. So here's what's going to be happening today in your city. 2 o'clock, we're going to have a Board of Health meeting. For any of you watching from home or watching online, you can go to siouxfalls.org/live to watch that meeting. We live stream it there. I'd encourage you to tune in and watch that. I will be recommending to that Board of Health that they support an ordinance that can be taken to the City Council that will allow the city to regulate retail businesses that promote public gatherings to modify their business practices in order to ensure that no more than 10 patrons are on the premise for on-site use of the services and or consumption of the goods at any given time. And that's consistent with our governor's EO. If the board chooses to support that recommendation, we will then have a 4 o'clock city council meeting. You can also watch that on siouxfalls.org/live. And Director Jill Franken will then present that proposed ordinance to the city council with that recommendation from the Board of Health in her back pocket there to support that. And should they take action on that, that will go into effect immediately, and it will make a violation of that a Class 2 misdemeanor. So let me unpack what this means. We've kind of just been essentially calling it a no lingering ordinance. Get in, do your business, get out. That's what we're trying to instill right now. What's included in this ordinance? Enclosed retail businesses that promote public gathering are going to be these categories. So if you fall in this category, you're going to be subject to this ordinance. A bar, a restaurant, a brewery, a cafe, a casino, a coffee shop, a recreational or athletic facility, a health club, or an entertainment venue. So that's going to include the parking, the patio areas, the indoor seating, everything, 10 or fewer patrons at a time. Patrons, okay? Not people, patrons. So the employees are not included in that. You'll notice that this doesn't talk about grocery stores. This doesn't talk about call centers. This doesn't talk about hardware stores. So we know none of those businesses are affected by this. What we're asking those businesses to do, the Walmarts of the world and the Hy-Vees of the world and the Lowe's of the world and the Menards of the world, is to implement practices in your businesses that support the EO of the governor and support smart social distancing in your business. And then the onus is on you as the individual to not take your family of 7 to Walmart and not take your family of 7 to Lowe's and not take your kids to Hy-Vee. Okay? You'll notice that there's no mention in this ordinance of essential or non-essential businesses. We're not categorizing certain businesses as essential or non-essential. We've identified that list of businesses that are going to be included in this ordinance. So this is another incremental step that we're taking as a city, and we're taking this step under the full extent of the law that's available to us in the city. And I continue to reinforce that. We're doing as much as we can based on the law that's available to us at the municipal level in the city of Sioux Falls. We know that people are going to have questions on this. I would also encourage, before you reach out to my office or to anyone, wait until the 2 and 4 o'clock meetings. This could change, they could amend, something could happen, but after that city council meeting, should they choose to support it, that's when it goes into law, and you should be ready to comply. But you can go to siouxfalls.org/COVID-19. You scroll to the bottom of the page there, and you can ask any questions on what this entails. Is my business affected? How will I be affected? How will I as a consumer be affected? Again, when you talk about essential and non-essential businesses, I want to clarify something as well, in that those are determined at the federal level. Those are not determined at the municipal level. So I'm getting a lot of people reaching out to me saying, my business offers manufacturing for this sector. We need to be deemed essential. We sell insurance. We need to be deemed essential. Those are not my decisions. Those are the federal government's decisions on essential and non-essential sectors. So you can certainly lobby me for that. I will not make any decisions on that if and when we get to the point where we have to take a deeper step here in the state of South Dakota. So for today's call to action, this is what I'm going to ask. A lot of you are sitting at home. A lot of you are looking for something to do. Take your census, okay? It's a census year. Every missed census a person we don't count in the city of Sioux Falls, I think costs us like $1,300 a year we lose in federal funding for people who don't take the census. So take the census at 2020census.gov. Go there, fill out your census. Doesn't take long. Super important to ensure we get the funding in Sioux Falls to do that. Lastly, I'm going to leave you with a quote. I heard this quote this week. I thought it was a great quote. It says this: when you are protecting yourself, you are protecting others. So think about that. When you're taking protection measures for yourself, in turn, you are helping a lot of other people stay safe as well. And so I'm going to turn it over to Jill, who has some additional updates on some of the COVID information we've got over the last 24 hours. Jill.
Thank you, Mayor. Substantial community spread of COVID in both Minnehaha County, as well as minimal to moderate community transmission in Lincoln County, reinforces our call to action. We will continue to mitigate community spread in Sioux Falls. And we've said it a lot, but the goal of these strategies is really, to reduce the spread and flatten the curve, to have as minimal and over time impact on the health systems as possible. And so that's what we want to aim for, reducing that transmission through our mitigation efforts, and then thus that helps us with making sure that our hospitals have all the resources when we all need them to be able to care for us if we should be hospitalized. So we're going to continue to work on that and continue to be reinforcing those efforts, and the activities and actions that are taken hopefully today will help us in that effort. So again, we all have a responsibility in this response. As individuals, we must implement our personal level actions, our social distancing, washing our hands, practice good respiratory hygiene. As business and community organizations, we also must implement recommended actions to limit gatherings, limit people being by each other, around each other, limit it to 10 people or less in social interactions, and making sure that we're all doing our part to be able to manage through this epidemic in our community and pandemic across the world in a favorable way. So with that, I'm going to turn it over to Janet Kiddems. She has some information to share with us from the Helpline Center.
Good morning, everybody. My name is Janet Kiddems. I'm the CEO of the Helpline Center, and I'm here this morning to just talk a little bit about how the Helpline Center is supporting our response effort for the COVID-19. The Helpline Center answers the 211 phone number. We also provide resources through our webpage, and then we help coordinate volunteers in the community. So I'll talk first about our phone calls and what we've been seeing with those. So far, we've answered over 3,700 phone calls directly related to the COVID virus, and I'll classify those calls into 3 different buckets. The first type of call that we've been receiving is really information-based. People are seeking information about the virus. They want to know the symptoms, how do I get tested, and they want reassurance on how they can keep themselves safe. So we work with all the great partners here at the EOC to disseminate that information to the callers. We provide information from the CDC to provide that sense of reassurance and calm to them about what the steps they need to be taking with that. Second type of phone calls we're receiving are people who honestly just need help. They're calling us and telling us, I just lost my job, my hours were cut, I've been furloughed, I can't feed my family, I can't pay my rent, what am I going to do? So we'll take as much information as we can from those callers, and then we'll identify the resources that are there to help them through this difficult time and get them connected to those resources. Third type of phone call we're getting is people who just need to talk. They need somebody to listen. They're feeling very anxious, they're stressed, they're worried. Just so much uncertainty, a lot of unknowns out there, and how our community is responding, how the world is responding to this pandemic. And so the Helpline Center is there to listen and provide support. And certainly if those folks need a connection to a mental health professional, we'll do that for them. And some other ways that the Helpline Center is supporting our community is through our website. The Helpline Center maintains a database of over 4,000 programs and resources for social service and government entities. And you can imagine the past couple of weeks, those resources have been changing almost on a daily basis. So my staff is working around the clock to make sure we have that information updated. New programs, programs that have been discontinued, new programs with eligibility requirements, to make sure that's available not only on our website, but through the phone calls when people reach out to us. In addition, on our website, there's many other resources, such as if you need to find a mental health provider, we have the mental health resource guide that you can look and find any provider in the area. We have those providers that specifically are providing telehealth or telecounseling if individuals don't want to go in to see the counselor face-to-face. So I think overall, I'll just leave you with this message, that what we're hearing from our callers, one, is a sense of gratitude, that they are so thankful that the Helpline Center has been there to provide support and to listen to them. But I want to send a message to everybody out there in our community. You're not alone. And if you're feeling alone, please call the Helpline Center. We're here to help. We have information, we have resources, and we can be there to support you. Thank you.
All right, we'll take any questions that you would have at this time. The Gov's also going to have a press conference at 12:15 today, and expect some timely updates from her office as well.
Is the unemployment increase that you mentioned before, is that Sioux Falls or is that statewide?
It's a statewide number of increases to the Department of Labor office. I talked with a gentleman actually last night, though, who said he was on a call with a bunch of business owners, and this business owner said, I had 800 employees, walked in and had to lay off half of my workforce today. And so that's a pretty substantial hit. All right. Yeah.
When it comes to parks and recreation around the city, is the city looking at limiting that in any way?
Yeah, the question is the city looking at limiting parks and recreation in any way? Currently, our indoor facilities, yes. Outdoor, no. At this time, that could change. You know, I'll tell you what I'm doing for my own family. My kids want to go to the park. We have a park behind our house. I said, go. I don't want you to touch anything. Don't go on the swings. Don't do, play at the park. It's hard to not touch stuff at a park because it's physical. But I told them to wear gloves. If you're going to go, and just we're taking some measures like that. But the parks are not closed to people right now.
You mentioned the website, COVID-19, can you give that out again?
SiouxFalls.org/COVID-19. That's where we have some of the local stuff we're doing on a municipal level, including the ability for people to submit questions on this ordinance that may go into effect tonight.
Okay, just leave it at being asked questions regarding that.
Yeah, that's where folks can go.
Heading into these two big decisions today, have you had any previous discussions to kind of lead up to what you might expect there?
I anticipate it will have support. It will have support for a couple reasons. One, we're not mandating any businesses to close. One, we don't feel we have the legal authority to do that based on the laws that we're operating with under right now as a city. Two, we're putting in some very strict rules and mandates that businesses need to follow. So we're still allowing businesses to operate, but we're putting some strict parameters on it. And in three, I think our council, who again ultimately is where that decision rests, feels that this is a proper balance, but a very heavy and serious approach that we're taking to this issue. So I anticipate it being supported. Great. Well, thank you guys. Appreciate you being here.